For prenatal cannabis exposure, here are 2 studies that highlight general trends in the data that make me urge people to not use cannabis while pregnant unless you have a medical reason for doing so. I'm Lex Pelger, a drug writer focused on cannabinoid science and sponsored by the National Cannabis Study out of Johns Hopkins. They're looking for adults who plan on trying cannabis for a medical purpose within the next 2 months. So if you know of anyone planning to start using medical cannabis to help with any condition, they can join the study, answer some questions, add to the public health data, and get paid $100 for their time. Look up the National Cannabis Study for more information. First, we start with this study, because even though it's just a retrospective chart review across 64 pregnancies, every month I see at least 1 or 2 papers with similar findings to this one. Now, for these pregnancies in my home state of Pennsylvania, of the people using cannabis, 30% of them had a preterm delivery versus 10% in the non-cannabis users. For low birth weight, this occurred in 24% of infants with prenatal cannabis exposure versus 8% of those without cannabis exposure. And this is one of the most consistent findings of any data on pregnancy and cannabis use. The baby is more likely to come out earlier and smaller. Now, is that the end of the world? Probably not. They usually tend to catch up in size within a few months or a year. But this earlier delivery time does make a lot of sense because for our CB1 cannabinoid receptors, some of the highest levels in the human body are in the female reproductive organs. And then for more concerning data, there are admissions to the NICU, which is a neonatal infant care unit. The rate of NICU admissions was 30% in cannabis users versus 10% in non-users. The predominant reasons for NICU admission were premature delivery, respiratory distress, hypoglycemia, which is low blood sugar, and neonatal abstinence syndrome, which is new babies going through drug withdrawal. There is also a higher likelihood of abnormal fetal heart rate, something that you see confirmed in the preclinical literature in animal models. Again, with a lot of cannabinoid receptors in your heart, it makes sense that a fetus exposed to cannabinoids could have alterations to their heart. Relatedly, our next paper is probably the most worrisome, though the chances are small. Now, there are these 2 researchers from Australia named Reece and Hulse, and I'm a little bit obsessed with them because they're such professional naysayers. For several years, they've been taking in public health data and pumping out epidemiological reports that show cannabis legalization linked to small increases in birth defects. In this specific study, they're looking at atrial septal defects, which is a hole in the wall of the heart. Looking at 100,000 cases of this birth defect in 17 million births across 27 US states, they found that the prevalence of this atrial septal birth defect was more prevalent in cannabis legal states. Now, oddly, the rates were also higher in some Midwestern states like Kentucky and Tennessee, where cannabis is farmed but not as legally available, suggesting other routes of exposure such as environmental contamination. Overall, Reece and Hulse conclude, and I quote, "Data shows that cannabis, including cannabis legalization, is driving the US atrial septal defect epidemic," end quote. And they've also reported similar findings for other birth defects, such as in the guts, Down syndrome, orofacial birth defects, and congenital anomalies in general, which are structural birth defects where bits of the body are missing. Plus, they found in adults increases for a number of types of cancer. Now, to me, as someone not trained in epidemiology, it appears that these associations are real, but that they are slight increases in the incidences of conditions that are mostly rather rare. You don't see reports like this from public health data that looks at hundreds of thousands of people. These 2 cats are finding in data sets that contain millions and millions of people. Plus, the US government has spent millions of dollars looking for negative reproductive harms from cannabis, and it's never been able to find any huge smoking guns. But overall, these moderate harms above do seem real, and none of this data contradicts what I've seen in the preclinical literature of giving cannabis to pregnant mice and rats. So, all of this is why I would stress to any friend of the family that if you're pregnant, not to use cannabis unless you need it for your mental health, or morning sickness, or some other pressing medical need. These risks are not gigantic, and whenever I make a video like this, my comments get flooded with people saying how much they smoke during pregnancy and how their kids are fine. And yes, statistically, what you're saying completely makes sense, but what I'm saying is that you're probably at least moderately increasing some small risks. And finally, to answer one question I'm sure I'll get in the comments, what about links to later behavioral problems in life, such as autism, psychosis, social deficits, or poor academic performance? And to that question I say, the data is so messy and hard to parse that I'm not going to cover it in this video. It seems like there might be some kind of moderate link there, but with half the studies finding a signal and half of them not, the answer is probably somewhere there in the middle.